Now, in the last segment, I talked a little bit about how I believed that, sure, for the month of April, it could make sense to continue with these economic shutdown policies here in the United States because we do need to flatten the curve and slow the spread. But after we get through April, the idea that we can last for months on end, as some are suggesting we might just need to do in order to combat this crisis, this concern of a pandemic, that's untenable. We cannot abide by that idea. We need to keep in mind the wide range of aspects to this story. It's important to do so. That's why I was very struck by a column for USA Today on Friday or Saturday entitled "Stop the Panic, Don't Let the Coronavirus Win" by an American who is, it seems, stranded in Europe right now, Alex Berezow. He is a PhD microbiologist, vice president at the American Council on Science and Health, an analyst at Geopolitical Futures, and a member of the USA Today Board of Contributors. And I'm so pleased to have Alex on to talk about his article, which resonated so much with me today. Alex, sir, welcome to the program. It's good to have you here.
Thanks for having me, Jimmy.
So what got you stranded in Europe? It seems that's what's going on, that you want to come back at some point. Tell us what's happening with you. And how you are doing, by the way.
Well, fine. I mean, lockdown is lockdown, right? If you're locked down in Seattle, that's my home, or if you're locked down in Poland, where I am now, there's not really much of a difference. You're still inside the house. Can't go anywhere.
Fair enough. Absolutely. Well, I want to just get your sense for where we are from the science of all this, because everybody's talking about, and understandably so, you have to look at the science in making decisions. The data is critical. But as I was also saying before, and we'll get to this, the decisions that you make based on science are only as good as those interpreting the science and also those who are then crafting policy based on the science. But how do you assess where things are at in terms of the spread of this virus?
Well, it's hard to say at the moment. We know that the virus is continuing to spread. There are signs that it's not spreading as badly as it was. The problem is that the models upon which these spread, the predicted spread are based is they're sort of dodgy, and that's not on purpose. It's the inherent nature of predictive models. You really don't know what's going to happen. And there were models that predicted anywhere from 4,000 deaths to 1 or 2 million American deaths. So there's a lot of uncertainty. The consensus is about 200,000 American deaths, and that's what Dr. Fauci has been basing his advice on, and I believe that's what caused President Trump to say, okay, we need to go into a lockdown. Those are scary numbers, and the truth is that we're sort of in uncharted territory. The last time we had something like this was a century ago. It was 1918 that we had something that threatened millions of people. That year, we lost 675,000 people to influenza. Now, that's massive. We usually only lose about 30 or 40,000 people to influenza each year. So 675,000 back in 1918 was a huge death toll. So we're looking at something that is potentially catastrophic. The question, though, that we always have to consider, that we don't seem to be considering, is that every action has a consequence. And when you decide to shut down an economy, that itself will have consequences. And that was really the only thing I wanted people to consider from my column. I didn't actually offer any policy prescriptions. I just offered people something to chew on, which is the cure cannot be worse than the disease. And I fear that by shutting down an economy, we're threatening to have a cure that is worse than the disease.
How about the argument, though, that we need to flatten the curve and stop the spread, and the way in which to do that is to keep people at home, limit their contact with others, not just through social distancing when you are out and about, but try to limit the ability for people to even go out and about, to go to their jobs and so forth, at the very least for the month of April. My big contention is not so much that April is a bad thing in terms of having these shutdowns, even though it is doing great harm economically, because we do need to take steps to try to flatten the curve and slow this spread. But at the same time, there are some who are saying this should last for months. The order for the governor for Virginia, Ralph Northam, is June 10th. That's the deadline. And I don't see how we could just go through this extended period of time with the shutdown and rely upon the government to provide for our needs?
I don't see how a shutdown can last that long because the economy will give out. And there's simply a reality that we have to deal with, and that's that people have to have food on their table and money in their wallets. And at some point, people are going to say, you know what, I'll take my chances with the virus. I have to get back to work. Uh, I don't think that politicians and our public health officials are putting enough consideration into that reality that this will not last forever. This cannot last forever. And that's really the reason that I wrote my column. I want people to think about the consequences of these draconian policies. Also, some of the societal changes that we're seeing. You know, where I live, there's a city called Bellevue, and they implemented a website where you could essentially snitch on people. So if you see somebody violating the stay home order, you could report them to the city government, and the city government will come by. You know, if they'll see if too many people are aggregating, they'll, I guess, tell them to move along or something. But it's really we've decided to have a major change to the way our society works without so much as a debate.
Yeah.
And I've been very surprised to see something like this happen in the United States, where people who a couple of weeks ago would have been saying that they'll fight for our liberties are now just handing them over to the government rather eagerly.
Again, we're talking with Alex Berezow, who's a vice president at the American Council on Science and Health. Alex, one thing here in Colorado, where I'm broadcasting from, that's illegal is handshakes. If you shake somebody's hand, you could be liable to go into jail and have a $1,000 fine, which I just think is outrageous, going to your point of this idea of no debate for these very significant changes to how our society's functioning. Now, there are some very good approaches that have been taken as far as the social distancing. I think that seems very reasonable. Let's keep people 6 feet apart and try to limit the exposure and some of those kinds of steps. The question is more, it comes to me to a matter of timing. I mean, you talk about in your article here for USA Today how James Bullard, the president of the Federal Reserve Bank of St. Louis, predicted that we're facing an unemployment rate of 30% and an unprecedented drop in GDP of 50%. Those numbers are worse than what we experienced during the Great Depression. Hopefully, the $2 trillion rescue package will prevent something that catastrophic. But the question is, how long can that $2 trillion package actually last before those resources are already exhausted? And then we have to do what the Democrats are suggesting, which is a phase 4.
Well, I'm afraid that we're going to find out, and that we won't have to theorize and hypothesize about what's going to happen, because it seems that we're on a trajectory to continue this shutdown almost indefinitely and trying to rescue our economy through bailouts. Now, I'm not an economist, but that doesn't seem to me to be a sustainable long-term solution. We have to get back to work. And I certainly don't think that it's unreasonable to ask places like Seattle, where we're having an awful lot of cases, or places like New York City, for them to go on lockdown and to shut down schools and businesses. That makes total sense. But you know, in other parts of the country, it would seem to be that we need to move toward a model in which healthy people are allowed to work, and the sick and the exposed are required to stay home. The elderly are required to stay home. But we need to slowly work our way out of this, because if not, I'm afraid we're facing some very tough economic times ahead. People don't realize, because it's been so long, people don't realize how bad the Great Depression was. It wasn't a typical cyclical recession like the global financial crisis from 2008. It was devastating. People were committing suicide. People were living in cardboard boxes. I mean, it was awful. And so when people become desperate because they don't have money, they don't have a way of making a living, true misery sets in. And to think that we're on a potential trajectory to repeat economic numbers that are as bad or worse than that, we really need to think about this before we continue on our path that we're still going down.
So you're a PhD microbiologist, means you're a scientist, and of course you're talking about and expressing concern, Alex Berezow, about the economic aspects of all of this. How do you think policymakers need to balance the concern for public health and the concern for economic health, which, by the way, does go hand in hand with public health. You can't truly say that they are mutually exclusive, but how would you advise policymakers to balance that just in the thought process, not necessarily go ahead and move forward with this particular policy, but as they develop policies for moving forward after April 30th?
Well, there's a way that economists do stuff like this, and there's a way that I think insurance companies do the same thing, which is you try to figure out what all the costs are of the policy that you're doing versus the cost of the other policy, right? And it's hard to do that, right? Because when you're weighing the costs of things, you're weighing things like illnesses and deaths, and it's hard to put a price tag on those things, but that's exactly what economists do. They have to. And then you weigh and you see, well, at what point does the lockdown turn into a net negative effect? Right now, I think arguably we could say that the lockdown's having a net positive effect. It's slowed down the virus. Not as many people are going to get sick. Not as many people are going to die. But at some point, be it this month or May or June, the net positive of the lockdown is going to turn into a net negative. And economists need to figure out when that point is, and we need to change trajectory before then. That would be the general strategy that I would advise the president and his economic advisors and his public health advisors to consider when deciding how much longer we need to be on lockdown.
Before we let you go, I want to get your response to former Vice President Joe Biden, who is, of course, running for President of the United States. This is cut one where he was specifically asked if the cure is worse than the disease.
The president has said many times now he's worried that the cure is going to be worse than disease. Does that concern you at all? And isn't there a point there that if this lockdown goes on for too long, the public health concerns could be grave?
Well, the public health concerns can be grave. And, you saw what's happening in Singapore. They moved very rapidly to bring down the coronavirus down to zero. And then they began to open up. They had very, very tight restrictions in terms of social distancing, et cetera, staying in place. Now it's coming back. And so, we've got what we need most of all, and it's not the president's fault at all, but we need most of all vaccine. But in the meantime, we have to take all the efforts we can to make sure we prevent the spread, lower that curve, as they talk about, and move from there. And that's why I think, George, we're going to need not only this last CARES Act that the Congress passed, which did a great deal, we're going to need at least 2 more iterations of that, I believe.
Your response, Alex Berezow.
Well, I mean, everybody's giving the best advice that they can, and I'm pleased to see that Vice President Joe Biden didn't make anything political. I think that at this point in time, we need to have Americans unified and trying not to take political shots. So I was pleased to see the Vice President do that. Whether or not we can do 2 more tranches of stimulus package, again, like I said, I'm not an economist, but I don't think it's a sustainable thing. I mean, the U.S. economy is, $20 trillion approximately. I don't think that it's sustainable to pass multi-trillion-dollar stimulus packages. I mean, it just doesn't sound like that's something that we can do realistically. The vice president is correct that we do need a vaccine. We're working on that. Scientists are working on that. The bigger hope right now is probably an antiviral. We can probably get something maybe by the summer or within a couple of months. There are some antibodies that can help fight the virus that other scientists are working on, but a vaccine probably will be at least a year or 2 away. Those vaccines are very, they have to be tested very thoroughly. And so we shouldn't hang our hopes on a vaccine anytime soon.
Alex Berezow, Vice President of Scientific Communications at the American Council on Science and Health. Thanks so much for joining us from Poland. We appreciate your time, and best of luck to you. I hope you can return to the States soon.
At some point, yeah.
All right. Alex, thank you so much. Really appreciate the time.
Thanks.
Once again, Alex.